we need to be aware of today. So then prior to the arrival of the emergency services, you attend to the victim. And what are those things you need to look out for when attending to a victim? You need to look out for you need to look out for the response. The response, I used to call it RABC. The response, the airway, the breathing, and the circulation of the victim. So when talking about the response, that is, you need to should be sure that the victim is either conscious or unconscious. How do you know if the victim is conscious? Is by asking some questions, little questions like, how are you? What is your name? What happened? How are you feeling? So if there is a response, that means the patient, the victim is conscious. But when in a case whereby the victim is not responding, that means definitely the victim is unconscious. So you need to ensure that there is response. Then the next one is to ensure that there is breathing. There is airway, rather. I said it is known as RABC. So they ensure that there is airway. So how do you ensure that there is airway? You ensure that there is airway by making sure that the victim is alert and at the same time responding to what you are saying. If the victim is not responding or being conscious, definitely probably something must have had blocked the airway of such victim. So you need to clear the airway by ensuring that the victim is in a suitable position. Probably when he or she is unconscious, the muscles I would have relaxed, making the muscle will have lost control, making the tongue of the victim to fall back on the throat to block the airway. Do we get what I'm trying to say now? So definitely an unconscious patient might have blocked airway. So you need to clear the airway by gently placing the head of making sure that your victim is lying down in a good position. Then ensure that the head is a bit tilted backward so that there will be air breathing in of air, and there will be airway. So in here there'll be airway, so for the victim. Then the next thing is to ensure the breathing. Ensure that your victim is breathing. Check for the breathing. How do you check for the breathing? Is when you see the chest region is we call it the diaphragm, is moving up and down. You ensure that you see that when someone is breathing, there will be something like. So the diaphragm moves up, forward, and backward. So ensure that there is breathing. Then the next one, there's no time, so I will try to brush through. Then the next one is circulation. You check for your breathing in circulation. Check for breathing. You check for skin color. You check for injuries, bleeding, and you arrest the bleeding as soon as possible. You arrest this bleeding as soon as possible prior to the arrival of the doctor or the emergency services. Why do we need all of this first aid? One is to save the life of the victim. Yes, if a lot of us have knowledge about first aid, a lot of people will not be dying there. It is a pity that today, when there is accidents, especially road accidents, a lot of us, we bring out our phones to video them, to video the victim, instead of us to carry out first aid and to save their lives. So one of the reasons why we need to know first aid is to save life, to prevent complications, and to prevent complications of such injury or such illness or condition. Another thing is to relieve pain for the victim at that moment. So I think I've been able to pass a little knowledge to us. There are more to first aid. There are more to first aid because there are different conditions whereby there are rules attached to them on how you can save the victim. So please, Whenever there is accident, whenever there is falls or any cases that needs first aid, we shouldn't look look at the victim and have this kind of nonchalant attitude towards them, or we should bring out our phone to be videoing them, snapping them just to carry out informations. Why, instead of you to help the victim and to save their life, to prevent complications and to relieve pain prior to the arrival of the emergency services. Thank you.